shift now to the final item for today, the third item on the agenda, House Substitute number 1 for House Bill number 332. Senator Pinckney has been able to join us straight away from Bond Committee, so we're going to go to Senator Pinckney post haste.
Thank you so much, Mr. Vice Chair, who is cosplaying as the chair today. Thank you all, and I'm very glad I got to come in and say welcome to the season finale of the Health and Social Services Committee. I have the pleasure of presenting House Substitute number 1 for House Bill number 332, and want to welcome the House sponsor, Representative Ross Levin, who's able to join us, and thank her for her work on this legislation, which is the result of several conversations that she was able to hold with stakeholders and get this bill to a place that I think is worth discussing today. And essentially what you'll find in the substitute and what the bill now does is ban the sale of kratom products to minors age 21 and under, while also working with DATE, which I guess is no longer going to be called DATE because I think we passed the bill on that, to see how we can study the state's ability to actually test these type of products to determine whether or not they're synthetic, the makeup of them, so that eventually we can come back and make safer state legislation around kratom as necessary. But this bill was a great first step to be able to work within the confines of what the state is currently able to do, study what we need to do, and then eventually come back and make those necessary changes.
Any questions at all from committee members? Senator Buxton.
Thank you. Just a follow-up to what I think you explained, which is I had anticipated legislation that would essentially ban synthetic kratom. And it appears that that's still the intent, but there's more work to do. Absolutely.
Thank you for the question. It's a great one. Yes, the original legislation would have outright banned synthetic kratoms, but the agency formerly known as DATE let us know that we don't currently have the capabilities to test kratom products and determine what actually is synthetic and what is what has plain leaf kratom. And so this is a step to figure out what we need to do to get our technology to a place to be able to test kratom products.
Well, I appreciate that. I assume it'll be kind of an initiative taken up over the off season and brought back hopefully in January, because I do think it appears to me to be a priority. I'm in this somewhat space. I'd introduced myself into this space by having received numerous contacts from folks that are kind of hung up. What I had learned, there is a difference between the plant and the synthetic, and that's why, again, I'm looking forward to seeing what it is that we can do to deal with the synthetic in the appropriate way. So thank you for that clarification.
Thank you, Senator. I agree with you completely.
Senator Siegfried, and then Senator Hansen, I think. Yep.
Thank you, Mr. Chairman. Okay, once again, I find myself opposite ends to our Delaware Healthcare Association and their letter of support for this bill. I thought at least that healthcare was about health. I don't know where they're coming from with this recommendation. So let me just go back, and first of all, I'd like to understand how the state is positioned to evaluate the synthetic or the actual leaf itself in this, in this product.
Thank you. Yeah, I think that goes back to the question that Senator Buxton just asked. The state is not positioned to be able to make determinations between the synthetic and the kratom leaf. That is why we had to take a step back. So if we would have tried to go forward with the banning, the state would not have been able to follow through with that, because we don't currently have the technology necessary to determine what is synthetic kratom and determine the makeup of kratom. So the answer to your question is we are not currently positioned to be able to do that.
Okay, and how are we going to be positioned in the near future?
That's the purpose of the report that is in this legislation. So the report that this legislation is requiring from the agency formerly known as DATE. I am slowly waiting for somebody to remind me what the new name is. The report that will come from them will tell us what we need to do to be able to get to a place to test kratom, synthetic kratom.
Okay, so I just want to refer the committee to a New York Times article published, I think, a month ago. The headline is "How an Addictive gas station drug found allies in the Trump cabinet. And it goes on to basically indicate that both the synthetic as well as the leaf itself has never really been approved or recommended by the FDA, CDC. It goes on to indicate that, powerful people in Washington kind of downplayed and pushed out the concerns of science over both the synthetic as well as the leaf. There are class action suits filed in 2023 claiming that the company Botanic Tonic targeted recovery alcoholics with advertising that this is basically, safe and a great alternative. The FDA evaluated, over 965 reports of harm, including 264 deaths. I mean, the list goes on and on and on and on and on. I don't understand what we're going to evaluate or why we need to evaluate when the facts are right before us. This is a dangerous drug. It should not be sold, period, to adults or children or anybody. So I'd ask the committee to really hold up on this, do a little more reading, and find out the damage of this medicine, or not even medicine, it's a product. Thank you.
Thank you. Senator Hansen and then Senator Buxton.
Yeah, I see in section 2 where it talks about the study that's going to be done, and that's great. But section 1 is all about banning the sale, providing, marketing of kratom or kratom products. I thought that this is, I thought I heard this is just going to do a study, but it doesn't appear to be that way, looking at the bill. I'd just like to have that explained. What is this bill doing?
So Senator Pinckney apologized. She had to get back to bond committee for votes. I'll note the bill bans the sale to minors. It's the minors only under age 21.
Yes, to minors.
Yep. And then does the study to figure out the testing. This is not necessarily typical to do, nor do I think it's good precedent to do it generally, but we do have the House sponsor of the bill here with us who had indicated that she'd like to speak partially in response, I think, to Senator Hansen's questions. So we will do that, but I want this entire building to understand that the Senate did not ask a House or Representative member to be here. Always welcome to be here. We did not ask, we did not insist, we did not mandate, and we are certainly expecting the same is true of senators not having to be over in the House to run the bills unless there's all a mutual understanding about it. So with that, hopefully abundantly clear on the record, ladies and gentlemen, I present to you the one, the only, Representative Ross Leventon.
Hi, thank you. So where we started, so a few things. Where we started with this bill was we were going to look at banning some types of synthetic kratom. And in doing lots of research and engaging with stakeholders across Delaware, natural leaf kratom is used in harm reduction. So we have a lot of harm reduction groups here who are supportive of natural leaf kratom. And states that have attempted to completely ban kratom have actually had to backpedal, including Rhode Island, because people who are getting off of heroin and opioids use kratom for harm reduction purposes. And so there is a legitimate use of kratom. The reason this bill took this step of the reason we had to take this step is in meeting with DATE. DATE does not have in-state capability for testing at all. And so what we were able to do at this step is just make sure that kids do not get kratom. Right now, any type of kratom. Right now, kratom is being sold everywhere. It's being sold at the corner stores. It's being sold all over the place. And so because we have no in-state capability for kratom, And there also needs to be beyond, the research is not just on testing, but the research is also about regulation. The research part is not just with DATE, but it's also DATE working with DHSS. It requires more work to do, but it was not going to be possible to do my original bill, which was going to try to eliminate the synthetic kratom because DATE does not trust out-of-state testing, and we have no in-state capability of testing because DATE has had trouble with out-of-state testing. So what happens, my understanding from working with DATE for the last several months, is that that the out-of-state testing has been inconsistent, which is why we've built in-state testing for marijuana purposes. And so this was what we were able to do now with the resources we have, which was to take an age gating approach and make sure kids can't buy it. Right now, kids of any age can buy this substance at the gas station. And so it was important to take this first step, make sure that kids don't get it, and then to work on the other big pieces, which are not just testing, but also regulation of this product, which has caused, it's frankly a mixed bag. It's all not, there are people who really, who are going through addiction, who use it to get off of heavier things, and they use it for pain issues. They use it, to stay off of heroin, to stay off of opioids. But we also wanted to learn lessons from other states because, a dozen or so states have attempted to regulate this, and the states that have banned it have found that have been problematic, which is why we didn't go for a full ban, because the harm reduction community really does utilize this to get off of the other drugs. So,
Senator Hansen.
Yeah, the problem that I have with that is that by kids, we're saying anyone under 21 years old. Many of the people that are now in recovery, who need to be in recovery, that I've worked a lot with, are below 21 years old. And so I would not want to foreclose this as their opportunity to turn their life around at an early age.
So the recovery organizations, and we have some here, have been supportive of the age gating. And so, so a part of that feedback with them, they've been supportive of the age gating. So I don't know if it's because they're able to, they understand the importance, but I have gotten support from the recovery groups to have the age gating in place.
Okay. And Senator Buxton?
I appreciate you being here, and I certainly support your initiative. I appreciate the dialogue. I assume what you're doing is you're trying to make the best of a current situation, hoping
Correct.
to improve it in the not too distant future.
Correct.
And I listen to experts, and I rely on the experts that have lived experience, ones that are actively going through it. A lot of times family members who have reached out and specifically said, like they did with the marijuana flower, that it legitimately has saved people's lives, right? When I took because I originally drafted legislation to ban kratom. Senator Hoffner evidently was doing it at the same time, and I said, well, you run it, I'll jump on yours. And then as she did, and the bill basically just killed all kratom. And I quickly realized that when you look at it, it's like the K2 versus marijuana. K2 is a synthetic marijuana that was exceptionally harmful to folks. And the marijuana, of course, we agree can be used, safely. That's what I've kind of landed on with kratom now. But my question to you is, have you looked at why can't we, at a minimum, just simply ban any product that's labeled with 7-OH?
Because you need the testing. So when we worked, that was originally what we did in the original draft, and you need the testing because there's a lot of mislabeling, And so Date came back to me with feedback that they weren't able to do that because they can't test, they don't trust the labeling. So you have to test all kratom.
But here's and that's fair. Store owner has a responsibility to understand the products that they have, specifically limited to that lane. Again, I get back to whether it is or it isn't, if it's labeled and identified as that, it's not legal to be sold. It's not legal to be marketed. That would at least give us cover temporarily while we get to a more robust testing measure. So I really am challenged by why we can't, you're just not allowed to present, market, sell, whatever on your shelves, anything that identifies itself as that.
So that's exactly where I started.
Yeah.
And I was told that that wasn't possible. So that's why this is definitely not an end step. This is a first step. This is what we were able to do now. But I had the same gut reaction. And I went round and round, and I don't know if Date is here. But
Yeah, I'd like to know.
they told me in a very thick document that it wasn't possible because of not having in-state capacity and not trusting out-of-state capacity. And part of their testing protocol is to not just test things that are labeled like that, but test things that aren't labeled to see if they're mislabeled. So there was not trust in having, in being able to do that. So this is what we can do now with the capability we have.
Okay.
So.
I would, and with this, if Date's here and would like to speak to this, I would welcome the opportunity because I seem to be with you on this.
All right, I guess, Representative Ross Levin, if you could please, you can feel free to take a seat on the Senate side wherever you want at all. And if Date / whatever the new name is, at whatever point that bill becomes effective, wants to approach, let's do that.
Good morning. I'm Lieutenant Mike Loazo with the Division of Alcohol, Tobacco Enforcement, soon to be the Division of Alcohol, Tobacco, and Marijuana Enforcement. So we just added an M into our name. One, I want to kind of talk to that testing aspect that you were bringing up. Part of it is we don't have, as mentioned, the in-state capacity. So whether that's through public health or Division of Forensics, we just don't have that capacity yet. Our out-of-state vendors don't have the capacity to test the level of 7-OH in a product. 7-OH does occur, from my understanding, naturally in the leaf, but at very small levels. So when you have those products that are synthetically created or synthetically raise those levels, they can say, yes, you have it, or yes, you don't, but the testing capacity in places state vendors we were dealing with didn't have that capacity yet to give us the level. So it's either you don't have it at all, in which case that would ban all of the products, or they just don't have the capacity to get to the level of what is natural versus what has been artificially bumped up. So that's where we kind of sat with that. If the original draft were to pass, we wouldn't be able to do the accurate enforcement of it because we can't get those levels. With marijuana, hemp, and things like that, we do have a portable testing device that does test levels, but that just doesn't exist in this space at this time.
So real quick then, speaking to what you're saying is other jurisdictions are going to use the same model to restrict synthetic. They're going to have their Date, or whatever you want to call it, test in the same manner that we are to ensure that it's only that microscopic level of,
Some of those jurisdictions, they put that in there and they're not really following up on it. We've been in contact and conversations with Maryland to see how they're doing it because their law was very similar to the original draft. We just haven't been able to connect to get a very in-depth conversation on what they are doing. But it appears a lot of their regulations are kicked down to their county levels.
What I do know and believe, listening to folks, and we see it on the streets, but when you hear from folks who say that this synthetic kratom is a real problem, is a very real problem, and the length of time that it's going to take to get from today to actually identifying how to take the synthetic out of the marketplace, we're going to lose people in that space. So when I hear us say something like, well, we still haven't connected with Maryland, no disrespect, but we have to connect, we have to understand, and I would really like to know from other states, are there those that are just taking a very simplistic approach to say, you can't have on your store shelves anything that identifies itself as a synthetic style, the 7-OH. or whatever you want to call that. That's what I would like to know, because if they're using that simplistic model, it makes it much harder for the retailers. Well, they're going to have to change the way they get the synthetic into the state, and maybe that'll slow it down. Maybe it'll start to eliminate it. I know some of the good actors aren't using it anymore anyway. So that, maybe it's more of a request and statement. I don't know. Thanks.
Thank you, Senator Buxton. Senator Siegfried.
Yes, so there are two products here, the 7-OH and I guess the regular Crantum, whatever you want to call it. There is documented 264 deaths. There is documentation of the fact that this kind of is toxic to your liver, that people can get addicted to Creighton as well. Can you discern the 07 or 7-OH from regular Creighton in terms of which one is more toxic to the liver and or the contribution to the 264 deaths? Can you do that?
That would be something that's outside of my wheelhouse, for lack
Okay.
of a better way.
All right. So, we have two competing products on the market being sold, and we're not quite sure which one. We do know documentation of deaths, documentation of liver the toxic and addiction. So, and I understand also, Representative Levin said it very well, that you just don't know what's in that product. It's not regulated. It could be either one, and if it is, then they can change it again, whatever. So what is the problem, again, of just banning it for now until the FDA or CDC or whoever does a in-depth test? Because we certainly can't do that.
That is a decision for the General Assembly to make. Again, this bill does the banning of sales to underage and the marketing to underage, and it does direct us and DSAM, the Division of Substance Abuse and Mental Health, to kind of work on that, more information, that report to bring back to make better choices. But to your point, a ban, that's a decision for the General Assembly to make.
Okay, so who's going to police that the product is not being sold to underage individuals?
So
How
the
are
way
you
this
gonna
bill is
find out?
written, any police officer could police that, whether that's Date, whether that's Middletown Police, whether that's the state police.
Right,
So if a parent
I
finds their kids have it, they're not going to know to call Date or whoever they're typically going to call their local
Right.
PD. This would empower them to hold that business accountable.
Sure, but how would they ever know?
There's typically some sort of legislative updates to police officers on new laws that have passed.
No, excuse me, I mean, how would a police officer know that a retailer sold this product to an underage individual?
So again, it's going to be reported, whether that's through the parent, whether that's through them just doing their job and finding a child in possession of it, or an underage person in possession, then asking them where they got it from, and then doing a follow-up investigation, whether that's reviewing surveillance footage, or the division has a program called our Cooperating Underage Witness Program, where we take underage kids to see if they can purchase age-restricted items, and going about it that way.
Okay, yeah, and I think that would be really problematic. I mean, I don't know how much time and effort you have to do that, as opposed to just saying, for right now, with the evidence that we do have, can't we just ban the product for now and go to the FDA and others that really do have the technology to evaluate this, both products, and eventually work out? Maybe we could have one of the two legalized, but for right now, I think there's enough concern over health issues that either product should not remain on the shelf. Thank you.
Thank you, Senator Siegfried. Anything else for Date / I think it would be DATME, maybe it would be.
We're trying to just stick with ATM for the alcohol tobacco.
Okay, I'll respect that. That's what you'll hear that from me then. I can't speak for 61 other legislators. Okay, thanks. Good to
Thank you.
go. If nothing else from committee members, we'll move to public comment.
May I have Brad Herno to speak on HB 332?
Hello, Senators. My name's Brad Harned, and I'm a person in long-term recovery. I am a certified peer support specialist with Impact Life. I have a history with using Kratom throughout my life, different times, in recovery, out of recovery. And I'm definitely backing the fact that it shouldn't be sold to kids. It's because if you use it at certain levels, you can get a little euphoric feeling from it. But other than that, I don't see a big problem with the product, except the 7OH does seem to have, I've used that before. It is a little stronger, but, I don't have a lot of experience with it. But I was happy to hear about the HB 332 bill because I think kids do not need access to any Kratom products. I am not totally against Kratom because at many times in my life it has served a purpose. I don't think anyone should be made to feel like a criminal who uses this product, and it doesn't seem like this bill will do such a thing. So I'm in support of HB 332. I had some other stuff I wrote, but I'm just going to go with that. So thank you.
Cool, thanks. Just to be clear, you can also submit written comments if you'd like.
May I have Christina Bryan to speak on HB 332?
Thank you. My name is Christina Bryan. I'm Vice President of External Affairs for the Delaware Healthcare Association, the Association for Delaware's Hospitals, Health Systems, and Related Healthcare Organizations. Thank you for the opportunity to speak in favor of this bill. DHA is pleased to support HB 332 as originally filed, and also the new bill as well. And I just wanted to, for the record, make clear DHA's support has been supportive of each of the Kratom regulation bills that have been introduced this year. Our goal is really to ensure that we keep people out of the emergency department that have had an adverse health event because of Kratom use. And so we are pleased to support this and the other bills as well. The one thing I did want to note, and I wanted to thank the sponsor, Representative Ross Levin, and also Senator Pinckney for their work with DHA. The original bill had a reporting requirement for DHA to report on adverse health events, but it's just difficult at this point to determine whether or not an adverse health event at the hospital has been Kratom related unless the patient self-reports. So just appreciate that they changed that language in the new bill. So thank you.
Now we'll go to Hannah for virtual public comment.
All right, first up we have Becca Chapman. Becca, you will have 2 minutes and your time starts now.
Hello, my name is Becca Chapman. I just want to start my comment by saying thank you so much to the senators and representatives who took the time out to speak with us and listen to our thoughts and concerns. Banning Kratom would be detrimental to my life as well as many other people in Delaware. I have been a natural Kratom user for about 9 years now. I suffer from my fibromyalgia, bipolar, depression, anxiety, ADHD, chronic pain, and more. Kratom has saved my life, and I don't just say that lightly. I have never been an illicit drug user. I've never been arrested. I've never been a criminal. Kratom does not make me high in any way. It helps me be a present mother and live pain-free. I'd also like to mention that even melatonin is not FDA approved because the FDA does not approve supplements per the DSHEA Act of '96. For over 8 years now, I've worked in the Kratom industry. I've seen firsthand how important it is to keep natural Kratom safe, legal, and accessible to adults with clear labeling guidelines. Please protect access to natural Kratom while keeping misleading and harmful products off the market. I urge you to support HS1 for House Bill 332. It keeps access to safe pure leaf Kratom, keeps legitimate companies like ours accountable, and eliminates any bad actors in the industry. Thank you.
Thank you. Hannah, anyone else?
Hi, thank you for letting me speak today. My name is Melody Wolf, and I'm in Kalamazoo, Michigan. The reason for me being at this hearing is to ask you to follow the HHS and the FDA trajectory without kratom and 7-OH. They want to get rid of 7-OH, and they are working on that, and I would really love to see you guys get rid of it as well. They asked me to speak at their national press briefing as a daily 12-year kratom consumer, and to talk about the benefits in my life and how it's affected my family, and then to distinguish it from 7-OH. I've been a chronic pain patient for over 20 years. I was bedridden for about a decade when my kids were in elementary school, and then I found kratom when my youngest was in high school. And it has given me my life back. And Becca and we are not one-offs. There are thousands of us. And I no longer need mobility aids. And although I wasn't there for my children growing up because I had a bedridden mom, I'm there for them now. In 2022, I provided an entire year of childcare for my newborn granddaughter. And then last summer, I did it again for 4 months, taking her to all the splash pads and zoos around. I would like to see you keep kratom access legal, and I approve of the age gate 100%. And Dr. Nora Volko, she is from the National Institute of Drug Abuse. She is their director, and she was our keynote speaker at the Kratom Scientific Symposium this year. And she is pro-kratom all the way. And there were healthcare agencies, everyone was there from the US. There were scientists and regulators. Not one of them talked about a kratom ban of any kind. What they did talk about was getting 7-OH off the shelves. And that I wholeheartedly agree with. And I would just encourage you to get rid of 7-OH and to make sure that kratom stays accessible for adults like me whose life has really improved so much. Thank you so much for your time. I appreciate it.
Next up, we have Adam Suib. Adam, you have 2 minutes, and your time starts now.
Good morning, Vice Chair and members of the committee. My name is Adam. I am a husband, a father of 3, and someone who has used kratom for about 10 years. For many years, I struggled to get clean. Nothing seemed to work long-term, no matter how hard I tried. Thanks to Pure Leaf Kratom, I have been free from drugs and alcohol for 10 years. Today, I have a stable life. I provide for my family, and I am present for my children. Unfortunately, Pure Leaf Kratom has often been blamed for problems caused by synthetic products and bad actors selling these products, such as 7-OH and pseudo and other adulterated substances that have no place in this market. The responsible kratom community has been pushing for regulations for years. We have been asking for standards, mandatory testing, accurate labeling, and accountability. Businesses that sell unsafe products should be pushed out of the marketplace. I believe this legislation is a strong step in the right direction. It protects consumers, holds companies accountable, and preserves the freedom of responsible adults to make informed decisions about their own wellness. I would love to see these protections built out even further in future legislative sessions. Federal agencies, including FDA, HHS, and even National Institute of Drug Abuse, Johns Hopkins University of Florida, have recognized the importance of regulatory approach rather than prohibition. Regulation protects consumers while preserving access for responsible adults. I heard deaths were mentioned earlier on. The CDC did their own study on kratom-involved deaths and determined that over 90% of them were polysubstance abuse, mostly fentanyl and fentanyl analogs, which a lot of coroners don't test for fentanyl analogs. So I respectfully ask you to support this bill. Thank you for your time and consideration.
Thank you.
Next up, we have David Eisenhower. David, you have 2 minutes, and you are now able to speak.
Thank you. I'd like to support the legislation for age gating kratom products. And while kratom did cause 233 deaths over the last 10 years, that is about half the rate of aspirin over the last 10 years. And if you take out combined substances in the last 10 years, 4 to 5 deaths per year for kratom. It's not that it's deadly, it's that many people do use the product for, well, help with facing their opioid addiction. And a blanket ban on the product would be bad, but age gating the product, I do believe, would be a good thing for Delaware and give us time to do the research to make sure we get the right products out of the market and keep the good products on the market. Thank you.
Next up, we have Laura Romney. Laura, you'll have 2 minutes, and your time starts now.
Yes, good morning, Chairman and members of the committee. I'm asking you today to please support this bill. It's been very interesting to listen to the conversation today surrounding this bill. Again, my name is Laura Romney. I'm actually a 9-year Kratom consumer, a daily consumer for my trigeminal neuralgia, which is a severe facial nerve disease that causes excruciating pain. It's actually been such a key in my life because it's allowed me to discontinue my opioid use and to be able to actually live and participate in life again. But I do believe that the age gate is the first step. I know there's so many concerns about passing laws to ban 7-OH, which I'm in full support of. But right now, the job should be to get this away from minors, especially 7-OH. So an age gate, I 100% support in that respect. But I do truly believe that there is a way forward to push this regulation to even more safe levels. There are other states that have accomplished this. There's many other states, 21 other states that have passed the KCPA, and I know that there are states that are doing this correctly. And, they're requiring vendors to actually have third-party testing, that they actually have to prove before they can market their product that each of their batches are laboratory tested, so that, your state doesn't have to go through all of the individual testing. So there are ways to be able to do this, to make this a safe law. But right now, the step should be to pass this bill and pursue further regulation in the future. But again, I plead with you not to consider a full ban. One last item I wanted to bring up is just recently, about 2 weeks ago, the National Health Institute of Health announced that they will be doing a human study on mitragynine, which is the main alkaloid in kratom. They are doing human studies.
I'm so sorry, Ms. Romney, but that was your 2 minutes. Please remember that you're welcome to submit any comment in writing up to 24 hours after the committee has adjourned. Last up, we will have Misty Brown. Misty, you'll have 2 minutes, and your time starts now.
Good morning, ladies and gentlemen. My name is Misty Brown, and tomorrow, June 25th, will mark my 7th anniversary of accidentally finding kratom. I was an active addict for 11 years straight, from 2008 to 2019, 2 FDA-approved pain pills, benzos, and muscle relaxers. Then I got cut off from my doctors and went to the streets and started doing cocaine. In June of 2019 was when I watched that documentary, A Leaf of Faith, and I walked into my neighborhood smoke shop and bought lab-tested whole leaf kratom. I was ID'd when I bought it. So age gating on this bill is absolutely perfect. We would like to see future regulations about banning 7-OH and its derivatives, because as my 7th year anniversary happens tomorrow, I will forever say this, that whole leaf kratom is an exit from addictions. Synthetic 7-OH and its derivatives are an entrance into one. So let's become the state number 22, please. Thank you for allowing me this time to speak.
All right, Senator Townsend, that is the end of virtual public comment.
Thank you very much. I just want to note that last public comment was maybe the best balance of substance and cheerfulness that I can remember, frankly, in my 14 years. So thank you very much to everybody. It looks like we're all set then. No additional public comment. I appreciate staff, as always, for being amazing to help us facilitate committee hearings, and the committee stands adjourned. Thank you.